said good morning, everybody. Much better, thank you. Today, we have our sponsors, a lot of them. We have 14 companies that sponsor today's program. We have Sandoz and Novartis, Memorial Healthcare, Viatris. They are our primary sponsors. Let's give them a round of applause. We had our community sponsors, TG Therapeutics, Mallinckrodt, Octave, FlowMed. Again, a round of applause, please. For everybody I did not mention, they're exhibitors, they're not sponsors, so I can't say their name because if they want it said, they got to become a sponsor. That's all. Just the next level up, guys, all right? All right. Dr. Coppola was born and raised in Fort Lauderdale. During his postgraduate training and board certification in neurology, he developed a passion to provide care for those living with multiple sclerosis. After completing advanced clinical fellowship training in neuroimmunology at the University of Miami, he became the Associate Director of the Palm Beach Multiple Sclerosis Center in West Palm Beach, Florida. Let's welcome Dr. Coppola.
Enjoy. Great, thank you. Thank you, everybody. Again, my name is Dr. Robert Coppola, born and raised in Fort Lauderdale, so I know this as my home, but I am currently practicing in West Palm Beach at the Palm Beach Multiple Sclerosis Clinic. So thank you for coming out today. Today I'm here to provide a discussion on access to MS care in your community. First off, I'd like to just define what is multiple sclerosis. Can anybody tell me? So to put it simply, multiple sclerosis, we're talking about multiple scars of the brain and spinal cord, right? And this is really being driven by an autoimmune process. This autoimmune disease really starts attacking the brain and spinal cord and attacks various parts of the neurons called the myelin sheath. And this damage actually causes damage to nerve signals. And depending on the area of the brain, depending on the area of the spinal cord, this damage actually produces symptoms, and really all we're dealing with are scars. And so playing with these, with the immune system, so to speak, and how do we prevent additional scar formation is really my job. And this disease, although there's no cure, there's lifelong chronic symptoms, relapses, and management that we have to attack in order to prevent progression. The prevalence of MS in the United States, there's about 1 million people and about 200,000 new cases each year. The median age of onset is about 30. And common symptoms of multiple sclerosis include fatigue, overwhelming sense of tiredness that can significantly impact your daily activities, vision issues, blurred vision, double vision, mobility challenges, numbness, tingling. A lot of times we have very vague symptoms, making this a very difficult diagnosis to make it at its disease onset. Additionally, it's quite unpredictable and having periods of new or worsening symptoms followed by periods of complete or partially recovery. It's a completely unpredictable pattern, making this a very difficult diagnosis to make. I'm sorry, I need to hold the mic a little bit better. Some signs of an MS relapse include numbness, tingling, again, blurred vision changes, overwhelming fatigue. And it's really important to have early intervention during relapses. So how do you prevent permanent damage? First, we have to identify these types of relapses and the onset of these symptoms. Rapid treatment for these symptoms can actually reduce inflammation, and additional therapies can shorten the duration and severity of the relapses. By doing this, we can maintain a good quality of life and limit the impact of these relapses and how they're actually attacking your brain to preserve independence. By doing all of this together, we can reduce long-term disability for you. There's a large role in MRI in the diagnosis. There are classical hallmarks of multiple sclerosis that we're looking for when we obtain an initial MRI. These scans identify scars in your brain and spinal cord. And we use additional scans over time to monitor the rates of disease progression and track to see if there's any new lesions developing. We also use this to rule out any additional or similar conditions And ultimately, we use all of this information to help you make an informed decision. There are several FDA-approved disease-modifying therapies, which Dr. Singhal just went over. Medications such as interferon beta, glatiramer, monoclonal antibodies, and oral therapies are all on the market these days. And each one is really just playing with the immune system, like I was trying to detail. Some of these mechanisms of actions includes targeting the immune response. They can either block immune cells or promote or prevent entry into the central nervous system. They may promote myelin repair, but ultimately what we're trying to do is reduce relapse risk and slow disease progression. We have plenty of oral, injectable, infusion-based therapies. Ultimately, sitting down with your provider and discussing the best route for you is the most important, because there's close to 30 of these medicines out these days, and making the right decision is probably the hardest decision, especially for newly diagnosed individuals. All of these medicines have potential side effects, and subsequently they all require routine monitoring. You should have regular checkups with your doctor. Patients on these medicines should ensure that the treatments are actually working. So making sure that you are following up with your doctor, whether it is in person, telehealth, medically, you need to make sure that you're being seen by your physician and that you're being heard by your physician. Common side effects include headache, nausea. Again, you need to have a good relationship with your physician in order to discuss this. Ultimately, these medicines are having a role in the immune system, so patients and providers need to be vigilant about infections and their recommendations for vaccinations. So what are some factors to consider when selecting an MS treatment? Thankfully, Dr. Singhal went over some of the clinical trial data and real-world effectiveness, but it is a very important factor, is how efficacious can my medicine be for me? What is the safety profile that I'm willing to accept? How is it being administered? Do I have to take an oral medicine every day, and do I have to inject under my skin? Do I have to come by to an infusion center and actually get infused? These are all determined by you and your provider to fit into your life, and in order to provide the best quality of life for you moving forward. And I hate this last one, but insurance coverage. Sometimes it is out of our hands, and we have to use we have to make some changes with insurance, and we have to talk and figure out the best plan for you individually. Again, navigating insurance coverage, it's one of my least favorite aspects of healthcare, but that's why we have a team in place. So you work with your provider, ensure that the prescribed medicine that you are provided is actually being paid for and covered. There's plenty of patient assistance programs that can help leverage and make sure that this is affordable for you. And there's accessible care to make sure that, again, we can have this afforded and it's appropriate therapy for you. I really like to use a lot of specialty pharmacies because they help me ensure that you're not paying as much as you need, as much as you are dictated by by not using some of these patient assistance programs. And these are pharmacies with deep knowledge of these medicines. They're able to help make sure that you get the medicine on time in a nice, convenient packaging. And they really help me help you navigate this insurance conundrum. So what is the South Florida MS care landscape? Again, we have plenty of, what I like to say plenty now, of MS care specialists. We're approaching 10, give or take. And some of the few examples are where I work at, Palm Beach Multiple Sclerosis Center, where I trained at, University of Miami Multiple Sclerosis Center. We have Cleveland Clinic, we have Memorial, Marcus Neuroscience Institute, of course, Dr. Steingo. We all have plenty of access to MS care. So if you're not with an MS specialist, I almost ask, why not anymore? These care options have interdisciplinary approach to your MS management. We have a collaborative care teams managing multiple sclerosis through various physical occupational therapists, neurologists, urologists, GI specialists, and we all work together to address your needs. This is a personalized treatment plan. So all of this is really for you. It's not for me, it's not for the provider. It's how can I make your life better? And again, we have comprehensive rehabilitation. So physical, occupational, rehabilitative services that are essential to address the day-to-day functional improvements, cognitive and emotional impacts of your MS and improve your quality of life. And the importance of this comprehensive care team is really to have that multidisciplinary approach. get additional opinions, and really understand how to cope with this disease. We need neurologists, physical therapists, occupational therapists, mental health advocates. We need to have a coordinated care team, personalized support, and ultimately, studies have really shown that if you receive care from an interdisciplinary team, the outcome is better as opposed to being with a single provider. So that brings me to the rise of telehealth in multiple sclerosis. There's increased accessibility, convenience and flexibility, continuity of care, personalized approach, and we can incorporate this into your MS care. By having telehealth, it's made people with multiple sclerosis get the care that they actually need in a timely manner. We can connect remotely and overcome challenges such as distance, mobility issues, or limited resources in your area. There's convenience and flexibility so that your appointment actually fits into your schedule and you're not waiting in the waiting room for an hour plus. There's continuity of care to where this actually helps keep track and manage the symptoms that you're living with, whether it's medication side effects, new or concerning symptoms in regards to your multiple sclerosis. And again, the personalized approach is what I think is key. So, another aspect, again, I do like timely intervention. We touched a little bit on improved access to care. If you're newly diagnosed in South Florida MS care landscape, there is no reason to be waiting 2, 3, 4 months to see a doctor, especially an MS specialist. By providing improved access to care to you, we can see you that week or the following week. We can really make sure that at least you're being seen by someone that knows how to manage your disease. And if you live very far away, then thankfully I have colleagues like Dr. Singhal, Dr. Steinger that we can also refer to, but at least we can get you seen and started. So what to expect? First, scheduling your appointment. To schedule a telehealth appointment, you can use your provider's patient portal, call their office, and they'll provide you with the information and the device that you'll need. There should be a pre-appointment checklist, and before you make your call, make sure you have a reliable internet connection, be quiet, or with a quiet, well-lit space, and test your device's camera and microphone to ensure they're working properly. During your appointment, your provider will ask symptoms, medical history, and any concerns you may have, and will also conduct a virtual physical exam. However, I do emphasize the importance of an in-person physical exam, especially when I'm forming that initial relationship. Telehealth etiquette and best practices. Again, angling the camera, framing the camera, position your face so that I can see you. Avoid backlighting and distracting backgrounds. Audio quality if you want to use a headrest or external microphone like this. And minimize background noises, but I always love seeing dogs. Ensure that your internet connectivity is stable and test your device to make sure that there aren't going to be hiccups in terms of our time together. And have a backup plan in place if that does occur. So again, coordinating in-person and telehealth visits, I think, is the most important aspect of having this being a part of your care plan. I think it's very important to actually see you. I think it's also very important to listen to you. So when I get a call from you and I hear something's off, something's wrong, I make sure to either at least see you telemedically and get you seen as quickly as I can in person, assuming I actually feel that you need that extra care. So coordinate these timings of in-person and virtual visits to maximize your care continuity. You need to communicate clearly from the get-go. The very first time I see you, I'm discussing expectations, requirements for each appointment format moving forward. And this way we can optimize the logistics of ensuring that you have the necessary equipment. But ultimately, this hybrid approach is what I'm using to improve access and convenience without compromising quality of care, which I think is the most important. So how do we empower patients to manage their MS? Again, we need to have a shared decision-making process. This is you and the provider. We should be building a good support network, and thank you for Stuart for having me here, and MS Views and News. And additional lifestyle modifications, adopting healthy habits, whether it's exercise, proper nutrition, stress reduction measures, all improve overall well-being. Some of these modifications include exercise and activity, regular physical walking, low-impact activities such as swimming, yoga can help manage these MS symptoms. Stress management and having relaxation techniques, including meditation, counseling, can help lessen the overall burden of living with this process. healthy nutrition, and I really advocate for quality sleep. Adequate sleep is really crucial, and you can never ask your brain to function appropriately if you're not actually recharging it at night. Addressing the fatigue and cognitive symptoms in MS, I think it's a little bit of a paradigm that I like to tell my patients. Well, the number one treatment for MS-related fatigue is exercise. And then we go, well, how do I exercise if I'm fatigued? And it's really something that you have to get on top of one way or another. I do have medicines. These are stimulating medicines, but do we want to be on medicines just in order to exercise? So really finding the balance for you is the most important, meaning we can take pacing activities, taking regular breaks in between these exercise, and if you need to take a break, you listen to your body. We can do cognitive rehabilitation exercises, improve sleep quality to help optimize cognitive function. Again, we can consider medications, but usually I really promote conservative therapies initially. Most importantly are these lifestyle adjustments, and incorporating physical activity, healthy nutrition, mindfulness techniques is usually the best overall outcome. So these do provide benefits for your body and your mind, and they help all of your overall MS symptoms. They also help anti-aging. So these types of activities work well, and this plan is just for you. The most important thing is to do it regularly. In terms of nutritional considerations, again, balanced diet. I'm a fan of the MIND diet, blue zones, omega-3 fatty acids found in fish, walnuts, flax seeds, and what I think is very under talked about is simply staying hydrated. This can really help manage the exacerbation of your fatigue and your muscle spasms and other symptoms. Counseling and therapy and just managing mental health and emotional support. Living with this disorder takes a toll. And working with a mental health professional can really help manage the stress, anxiety, and depression, sometimes changing how we view the world and seeing grass as green versus brown is really all we need to do sometimes. Connecting with support groups and others living with multiple sclerosis provides a sense of community and shared understanding, and these self-care practices ultimately are for you. So at the end of the day, I want you to focus on building a strong support system. Connect with others, find friends, family, people who can understand what you're going through, talk to others, and help them help you make feel better. Join a support group. Joining MS support group in person or online lets you really share your experiences, get advice, learn from others, lean on your loved ones, tell them what you're going through. How can they best help you is the only way they know what you're going through. And seek professional support and therapy. A therapist or counsel will at least help you understand what you're going through and help you mitigate this. Sometimes we find ourselves into what I like to also say, negative snowballs that turn into avalanches. And really just getting on top of that and identifying this is really what we need to focus on. Coping with the uncertainty. Again, a lot of this, we need to be able to embrace the unpredictability of this disease. Sometimes looking at the world is all we need to do. Looking at the world differently is all we need to do. Practice self-care, stay informed, and be your own advocate. Advocating for yourself as an MS patient, again, I want you to be voicing your concerns. Please do not be afraid to speak up and share your experiences with your healthcare team. I can only understand if you tell me. And a lot of times I have patients tell me, oh, I'm fine, leave me alone. Okay, I will. So stay informed, learn about your condition, treatment options, and resources. Being an informed patient will help you make the best decision. And again, build your support network, surround yourself with a team of healthcare providers, family and friends who can advocate for you and provide emotional support. That's where I need my team to help me navigate this entire system. Understanding insurance coverage, accessing specialty care. This is a very complicated process. Part of my team's job is to really help learn what your insurance even covers. So I might make a recommendation with you, or we might make a plan, and then ultimately the insurance doesn't like our plan. So we have to really navigate this decision together. Coordinating your appointments and joining advocacy groups all come together to help navigate living with this disease process. Some resources for newly diagnosed MS patients, again, support groups, connecting with others, and educational resources. The worst thing I could ever see a patient, or newly diagnosed patient, especially in South Florida, if you're getting diagnosed and you're calling your neurologist and you can't be seen for 2 to 3 months, just call me. And again, online communities, just participating in online forums, social media groups, access information, and build a network so that you can really have the support system that you need in place. There are clinical trials, research opportunities in MS. These are advancing treatments, ultimately helping me understand this disease process just as you guys are trying to learn it. There are various different ways to play with the immune system, how I like to say it. And how we do this requires additional clinical trials. They do provide access to cutting-edge therapies that might not be around for another decade or so. The future of multiple sclerosis therapies, we're looking at innovative therapies, including stem cell therapies, myelin-promoting therapies. Dr. Singol was talking about this. But ultimately, what we're trying to do is protect the neuronal level. This really needs to be a personalized medical approach. And hopefully in the future, advances in genetics and biomarkers will actually even make this more tailored to you. So with that, the takeaways and key considerations, I really believe early detection of this disease is crucial. Early identification of symptoms and early access to intervention is key. Your therapy should be personalized. Every person's MS journey is completely different. Everybody is living with this in a completely different manner, and how your treatment fits into your life is the most important decision I can make with you. And leverage telehealth. Integrating telehealth into your MS care plan can provide convenient and easy access support, especially for those with mobility challenge or busy individuals with work schedules. So with that, I'll open this up for a Q&A session. And yeah.
How you doing? In reference to MS and siblings, is there any hereditary truth to that when brothers, sisters, parents?
I would say we've seen an increased likelihood anecdotally, but we don't have the best genetic markers or best genetic evidence to say that it's homozygous dominant or anything like that. So I would say that there can be some increased risk in familial disorder, yes.
Over here. Hi, thank you for your presentation. I had a quick question over here. You mentioned the Mind Diet and Blue Zone. Could you talk a little bit more about both of those?
Sure. So my colleague, Dr. Steingo, he's a big mentor of mine, and he turned me on to this several years ago, and it's really called Into the Blue Zones. Most of my patients, I tell, hey, if it's tough to make you read something, and this is a very long podcast. So it's actually a 4-part documentary on Netflix. So the easiest thing I can tell my patients, hey, go on this weekend, tonight, tomorrow, just watch Into the Blue Zones. It's about 3 to 4 hours, and incorporate as much of that into your practice as you can. At the end of the day, I think we're all aging, and there's not much we can do about that. And that's going to open my next discussion with Dr. Steingo. But how do you really combat aging? And then when you tackle MS plus aging, how do you really do this? This is practices that you should be doing when you're young, when you're actively working on your diet, working on your exercise. And really what the Blue Zones tells us is that don't be American. That's the easiest way I can put it. So we look at different populations across the world, and we're looking at how they're walking to church, walking to the grocery store. They're accidentally buying the healthiest food they could, whereas we don't have that access in America. So how do you really fight what the American system is feeding you? Watch Into the Blue Zones and incorporate as much as you can. Try to exercise on an everyday, regular basis, and having this helps you get to 100 years old, and that's really the goal for everybody.
A question online, person is asking, when is it time to stop taking a medication and switch to another medication that might be newer and better?
That is a discussion with your healthcare provider.
Okay. Next question online, real quick, is can you tell us a little bit about MS relapse?
What was that?
MS relapse?
Sure. So MS relapse is quite easily defined as new or worsening symptoms lasting greater than 24 hours. So are you having any new or worsening symptoms lasting greater than 24 hours? If so, yes, give me a call. Otherwise, I do sometimes push for an MRI to make sure that there's a new and enhancing lesion, because a lot of times this can be very confusing. And not all relapses are the same. Some can be very aggressive, and some can be very subtle. Some can be very stress-provoked and intermittent, so to speak. And sometimes we can see improvement just by sleeping off. So I don't treat every relapse, but I make sure I understand what's going on. And how are we defining this relapse? Because we have something that we call as a pseudo-relapse. And a lot of times we can feel symptoms that we've experienced in the past. And now we're just increasing the risk of complications from steroids or additional therapies to treat stress. And that's not always the best way to manage your stress.
So what are your treatments for a person having a relapse?
So we do have different injectable therapies. We have steroids, and we also have Acthar and ACTH. These therapies have been around for some time. I think the steroids are usually the predominant way to treat these days.
You sort of answered it. Since MS relapses, this is where I'm going, since steroids do not alter the progression of your MS in the long run, is it better to ride out your relapse instead of going on steroids? What are the pros and cons of going on? But you sort of answered that. It depends on
there are other options to treat. And anybody that has had poor response to steroids, I would advocate that they talk to their healthcare provider and say, hey, are there any other options to treat this disease or my symptoms right now? And I think that's most important.
If I have a relapse, are you automatically changing my medication?
Automatically, no. Everything is very patient specific.
Okay.
Okay.
I need to know you would probably be the best way I could put that.
Presumably you would know me.
Presumably I would, yes. But when I hear automatic and this and that, I don't have anything that's automatic. I just need to know what's going on before I make a decision.
But it would be a consideration to change
Absolutely.
the medication.
It would definitely be a consideration, absolutely.
Thank you.
You did answer the question about there possibly being a hereditary factor for MS, but do you ever weigh the difference between hereditary and environmental? Because in my hometown, I happen to know a lot of people, some related, some not, that have gotten MS.
The way I like to put this is multiple sclerosis gets turned on. How does it get turned on? We have enough genetic and environmental risk factors that eventually it turns on. So could it be Epstein-Barr virus that just turned it on in a genetically susceptible individual? Or they're not even genetically susceptible. So it's an accumulation of factors that just turns on the immune system to a point where we can't necessarily turn it off. I hope that helped.
Yes, hi. I know the actress who just died recently, Terry Garr, who they said she had MS, and in the article I read said that, she died of MS, but then I know reading many years ago that we're most likely to just die basically like everybody else, So I'm just wondering what you think of that.
I think the complications of MS can get bad. Just like the complications of Parkinson's disease, the complications of a lot of the neurological diseases that I treat. At the end of the day, aging is a chronic, progressive, deteriorating process. So aging in and of itself can get bad. And ultimately, do you die from MS? No. You die from the complications just like you do of aging, just like you do of Parkinson's, just like you do of all these diseases.
Hello. What do you think of those little stores that have popped up recently where you can get like IV vitamin injections? You sit in there for like half an hour or whatever and they give you a big vitamin. What's your thoughts on those?
I asked, does it help? Try it.
Well, I'm thinking, should I, or am I just like throwing away like $100?
If you can afford it and you're suffering with fatigue, why not try it? Give it 3 months, try it, and if it doesn't help, stop spending your money.
And do you think that, I mean, would you apply that to MS patients? I haven't got MS.
Absolutely, yeah.
Yeah, okay.
Hi. So going back to not necessarily heredity, but have they found, and I know they don't know all the things about MS, have they found any links to any other autoimmune things? Like if you have MS, you're more likely to have XYZ or the reverse?
This is your immune system gone haywire. So once it's haywire, yeah, you have this tendency to...
It opens Pandora's box.
There you go.
Awesome. Thank you.
You need to talk about neurofilament light.
What about it?
You need to tell the world, you need to tell them what.
So this is a protein that gets elevated. We're studying it as far as markers to monitor. Is this a marker that we should be monitoring in PIRA, in relapse activity? Could this be a risk factor to suggest disease progression? So we are checking it, and we are looking at it. We are saying, yeah, probably. That when we see elevated NFL, that it can suggest disease progression, but we're still learning a lot about it.
Okay, and can you tell people, please, the difference with the different serum neurofilament light testings there are?
I think that's the same question, no?
No,
So one more time?
there's more than one test.
So as far as CSF versus serum neurofilament light, I would prefer to get CSF neurofilament light, but we can use blood tests to monitor the same NFL level.
Okay, any other questions? Okay, then let's give the doctor a round of applause.
Thank you.
All right. We have our photographer back. That's good. Thank you. Awesome. Thank you very much. Thank you. Have a good day. Be safe, everybody. Do what you got to do in life, all right? Don't let MS stop you. Don't let MS stop you. Take care. Have a great day.